All right, I'm in side lying position right now. This is one of my favorite positions for working on hip rotation. It puts your hip and the rotational capacities of your hip in direct opposition of gravity. So gravity moves up and down, and if we want to work a joint or a range of motion against gravity, we have to make sure that that movement is going almost directly up and down. Okay, so when you're in side lying position, we don't want to kind of just lay here lazily. Basically, we want to stack our hips on top of each other, but then also stack our shoulders on top of each other. So if you took a pole and drove it through my top shoulder and my top hip, it'd go through the bottom shoulder and bottom hip. That's going to clear a little bit of space here. You shouldn't be sinking into the ground. Okay, that's what I talk about when I'm talking about this position. You can't be lazy. You can't just kind of chill here and kind of get this arch through the top side of our spine. We want to drive down in the ground with this bottom arm, drive down in the ground with this bottom leg, and then we're going to work this top leg. So the leg's going to come up into full hip flexion, a little bit of tension in through the core, still driving through the ground with the leg and the arm, and then we're going to rotate once we reach in range. If you want, place a hand here so you keep that hip flexion. People typically will drive the leg away to get a little more rotation. We want to avoid that. So hand can go here if necessary, and then the foot's going to rotate down, holding for 5 seconds, and then rotate up, holding for 5 seconds. All right, and you're going to do 5 reps in each direction, trying to make sure that your pelvis isn't hiking and dropping as you go through this. When you go into external rotation, which is foot into the ground, that pelvis is going to want to drop down to allow you to get more range of motion. That's not external range of motion. That's a pelvic compensation. And as you drive that foot up into internal rotation, that pelvis is going to want to hike up to allow you to get that leg even higher. Again, that's not rotation. That is pelvic compensation. So 5 reps, holding for 5 seconds in each direction on both sides. That is going to open up your hip rotation capabilities and really allow that hip capsule to have a lot of room for movement, giving you a nice healthy hip, improving knee pain, ankle pain, low back pain, and of course hip pain as well.